are these early signs of depression? What should I do?
Yeah, that is a very good question. I have a teenager that does the same thing too. I believe that he spends too much time on his cell phone playing games. Um, I think uh, we have to definitely try and limit that. But if he is willing to give up his phone when you say, give it to me, and he's willing to give it up, I don't think it's as big a deal. But I do feel that many teenagers, in fact, a lot of them, spend too much time on the phone. Now, I did hear this is not from me. I'm quoting someone else. I heard someone on Christian radio talk about the illustration of money, and the question was posted: if you have 86,000, I think it's $86,400. If someone gives you that, um, what you plan to do with it? Now, there are some rules. One, um, it's got to be used every day. You're going to be given $86,000, $86,400 a day. The rule is you have to use it every day. What would you do if you were given all that free money and you had to? There was a time limit. Um, what would you do with it? Ask your son that, and he may come up with some ideas. Then after that, tell him that really what you're talking about is not money, but time. It's actually the number of seconds in a day. It is 60 seconds times 60 minutes times 24 hours of the day. And that's what we have, 86,400 seconds a day. And what would we do? Uh, how would we use it and not waste it? So maybe that might help. But going back to your question, um, playing games on the cell phone itself uh, would be too little information or would be too premature to um, come to a conclusion of depression in that child. Um, so yes, I do believe that they spend too much time playing on the cell phone, but it's not truly an indication of mental illness or depression.
Great, thank you. That's another question. You said that my child has depression, but he refused to see a doctor. Then what should I do?
Okay. Well, that is frequently the case, and it can be a problem. It depends on how severe the depression is. If it is sort of mild depression, um, and you think it can be dealt with just by outpatient therapy, but he won't go see a therapist, I would say frequently I recommend the mother or the parents to go to therapy themselves, because sometimes um, for the parents to talk about it may give them more information about how severe that child's depression might be. Um, firstly, I would recommend that the parents, if they found a therapist, to see a therapist for family therapy to begin with. Uh, then they can kind of slowly work out how severe or how problematic the problem is. Then I would say give them a period of time to uh, sort of work with them about whether they should see someone. Again, if problems continue to persist and you see the symptoms worsening, then you may have to take further drastic steps. If it comes to the point where they're not wanting to go to school or they've they're failing school or dropped out of school. To me, that's the next severe problem. And then the final problem would be if they're beginning to self-harm, or you worry about their safety, or safety is a problem. At that point, you may have to consider putting them in for an inpatient admission um, to a psychiatric facility. There are many in the city these days, and they're all about the same. They have their limitations, but they do help. And usually everybody's helped by an admission. Of course, it's fairly drastic, and it's, it's having to force a child into an inpatient admission. But even though that may be the sort of the last straw, it can also be the most helpful thing to do.
Thank you. I have another question. It said that here that if the kids have mental health issue, refusing to go to school, if that's okay to have police officer to handle. 孩子有精神问题不肯去上学，可以请警察来帮忙吗？
Well, I have seen cases where sometimes the use of the police can be helpful. It sort of scares them, and sometimes that's helpful. Sometimes the school police can be helpful too, because as you know, it is the law that a child goes to school. So I think you should try all kinds of ways, even if it means calling the police. Another thought I had too is, again, seeing a therapist, seeing someone, even though the therapy may eventually be for your child, it might be helpful to talk over the problem with someone who is experienced and kind of have a game plan about what to do. And sometimes that might include calling the police. Sometimes that might be a negotiating point to maybe see a doctor instead of seeing the police or seeing a therapist. Sometimes that might be helpful. So there is a place for the police. I would say if there is a situation where the arguments become overwhelming, become really big, where there is fighting and possible violence and so forth, then obviously it would be appropriate to call the police. And at that point, usually the police can be helpful in escorting that child, that individual, to an emergency room. And from that emergency room, then they can be safely transported to a psychiatric facility. I have seen many cases where the police will help by transporting a child from their home or wherever to a major hospital emergency room. They won't take them directly to a psychiatric facility, but they'll take them to, say, Memorial Southwest Emergency Room or Bentab Emergency Room, or next to Bentab, the Texas Mental Health and Texana MHMRA, the Texas Mental Health and Mental Retardation Authority, have a facility called the Neuropsychiatric Center, NPC. And that's where all the psychiatric emergencies go. So if you have a child that is actively resisting and starts to be threatening and violent because he refuses to go to school or whatever, I have had cases where they've been transported there and then dispersed to a psychiatric facility, especially if they are suicidal or they are deemed to be at high risk of hurting themselves or hurting someone else.
Okay, great. Let's see. I have another question here. If a child has a father that's alcoholic, what can we do? 孩子的父亲酗酒，我们能做什么？
Yes. that is in the CPS population, the foster children, that is frequently a big problem. Um, well, I would say again, the use of a therapist initially would be helpful, especially if it is the spouse, if it's the father and the mother doesn't know what to do. It might be helpful to talk with a therapist first. And if the child's willing to go, for the child to be able to open up and share about what they, uh, you know, how they might be feeling about it. Um, Frequently in therapy like that, um, depending on where the therapy goes, there may be multiple options. One of which, if the father uh, is so dysfunctional that he might become violent or something like that, then there might be a need to flee or to get away uh, from that home. Um, but if the father is just a functional alcoholic who is not violent, there may be a need to talk with the therapist about trying an intervention where you get some friends, friends from the church, or someone to encourage the father to go get treatment for himself. So there are many options. I think, again, the first step would be to seek treatment with a therapist, someone that can sit down, and the therapist may not initially have all the answers, but it's through talking, discussing, and letting the family open up about the problems. But again, violence is where we draw the line, and if it comes to that, then then obviously there will be need to take more drastic steps, like leave the home, that kind of thing.
Thank you. Okay, I have another question. It's like a child of 14 years old, he has the tics disorder.
Mhm.
And is there any medication or therapy that can heal it? Because the child feel very bad about himself. And does it worth taking the time and effort to do the examination?
Yeah. Firstly, a disorder is more a neurological disorder than it is a psychiatric disorder. But there are uh, a few neurologists um, in town in Houston who are um, movement specialists, where they specifically deal with tics and that kind of thing. Um, so I would say the first thing would be to get a neurological evaluation. Secondly, tics could be related to a syndrome called Tourette's syndrome. That is, again, another um, mainly a neurological disorder. But there are certain spectrum disorders that include tics. Like, for instance, there is a spectrum disorder that includes ADHD, OCD, and a tic disorder. For some reason, it is a syndrome where all three disorders occur at the same time. That may be helpful uh, for that child to be seen by a psychiatrist, just to rule out OCD, just to rule out ADHD, and to get those conditions treated. And for the psychiatrist to work closely with the neurologist uh, to get help. There are medications that can help with um, tics and so forth. So, and in the end, as you say, if a child has a condition where he can be successfully treated, it will definitely help his self-esteem, help his self-confidence, those types of things.
Okay. Okay, we have 15 more minutes. We'll just try to answer a few more questions, and then we have to let Dr. Tan rest. What if the kids like to talk to the therapist more than to the parents? What can the parents do?
Okay, so you would be like a helicopter parent or uh, you know, remember when you engage the therapist, you have an understanding with the therapist that um, uh, that therapist should have all the opportunity um, to be able to uh, communicate uh, confidentially with your child. To the child, I would say, if a child is finding a therapist helpful, um, then that is a good thing. In other words, um, you know, that child has fostered some type of what we call therapeutic alliance. In other words, that child has been able to form a relationship with the therapist where he trusts the therapist and is willing to open up and talk about things. And a good therapist will say, listen, what your child shares with me, uh, I'm not going to share with you unless what he shares is something that um, is a danger issue, where if he shares that he's going to hurt himself or something like that, then that is the only time when I will, talking about the therapist, that I will share with the parent. Um, but otherwise, um, the fact that a child feels confident and uh, willing to open up and talk to the therapist is a very good thing, because many times adolescents, they don't dare talk to their parents. You know, it's at that stage where communication is already very difficult. So um, so if you have that opportunity, of course you have to trust the therapist, and that the therapist is experienced and knows what he or she is doing. um, but the fact that he or she is able to have created a therapeutic alliance with your child, and that your child is comfortable in opening up, that is a good thing. Now,
Great. So,
just one more thing. Before you start therapy, you might also want to lay some ground rules with your child, with the therapist, and with everybody else, where maybe um, at regular intervals during treatment, maybe the third or fourth or fifth session, that you guys meet as a family and share limited information that might be helpful for the parents to know. Not necessarily all the information that the child shares with the therapist, but some information that would be helpful for the parent to know.
great. Um, Next question is, someone is the video recorded and being available? Yes, please go to our website and then give us some time, maybe a week. We will put the link of this very variable seminar on our website, so you can visit there. Next question is a long one. My son is a senior high schooler. He is doing very well academically, but in his high school year, he does not have any friend. He isolated socially. He has some bully experience in middle school. Now he most talks only to parents and teacher, not much to others. Sometimes he talks to himself, yelling to himself to stop. I asked him why. He said he thought some embarrassing moment. He wants to stop thinking. Is there any concern? Seems like he does not want to do therapy. How can parents help him? Nowadays, mostly he talks to himself a lot. Is this normal?
Okay. Um, there, there are certain things that you have said that are concerning. I can tell you that talking to oneself is not normal. Um, Being isolative is not normal. Um, Having few friends is not a good thing. Um, but again, as you say, there are certain aspects of his life which seem to be okay. Like, for instance, academically, he's doing well. So is he just your shy child? We don't know. Firstly, I would recommend the very first, most important thing is to consider getting treatment. seeking, if not a therapist, go directly to a psychiatrist or a child psychiatrist, because there are certain things that you've said that sound concerning to me. So that would be the first thing. Secondly, um, uh, if you feel like you have a good relationship with your child, um, it may be helpful to get that get that individual involved in something that is uh, fun for him, exciting for him. Now, many times with children of school age, I will say, not every kid is a sportsman. Not every kid has athletic skills and so forth, though that is a good form of an outlet. But for a lot of school-age children, of course, it's a little bit late for a senior in high school. But there are other things like scouting or FFA in the U.S., the Future Farmers of America, or 4-H, where a child takes an animal, a rabbit or a goat or something, and raises it. It's a non-intrusive thing that they can do. Of course, this would be for a younger child, or get them involved in something that they enjoy, where it would afford more interaction with their peers. Um, he may be good at chess. Have him be involved in chess, or um, art, or you know, uh, if he likes music, play in a band. I mean, or worst comes to worst, uh, volunteer at an animal shelter, something that can take him out of something that is non-intrusive, something that is not too hard to do. Get them involved. Um, but if all fails and things are um, looks like they're regressing and getting worse, um, you might have to go through that intervention that I mentioned earlier, where you call uh, the authorities. You can apply for a um, involuntary commitment at a psychiatric hospital and have that. I don't know your case, obviously, and what I'm saying might be overkill. It might be too drastic a situation, but um, one can actually get someone, especially a 17 or older, involuntarily committed to an inpatient psychiatric facility so that they can be evaluated, so that they can be helped. Sometimes that last option is the only option.
Great. Last, I think, I'm going to, because of time, well, I'm going to just ask one more question. It's more, related to our current time. Is that like during pandemic, we stay home and we want to spend more time with our child, but he refused to interact and spend time with us. What do you have any suggestion?
So, you want me to answer as a professional or as a parent who's uh, struggling with the same issue? Um, you want to meet them at their points of need, or their points where they will be helpful. For our son, we interact best at the dinner table. He loves to eat, so he has to eat, and he needs to be fed. So that's when we interact best. So just make sure that the lunch hour at home or the dinner hour is reserved, and make it so that it's a good time. Another thing you can do is do a little bit of simple exercising with your child. Maybe uh, taking a daily short walk or exercise. Sometimes that can be helpful. Um, you know, and even sometimes watching a favorite show with him, even though you're not interacting that much. at least that's a start in getting to do more things together. But yeah, you're right. It's a challenge, and but you've got to be creative. And I
Okay,
think
great.
most parents have it in them to think something up.
Yeah.
So,
Okay, we have just one last question, but I feel like that question is not completed. It's like my child broke up with a little boyfriend or little boy, and but then the question was not complete. So it is hard for us to guess what the question is. But I think teenager breaking up is usually seems like they're very depressed, but maybe is Dr. Tan have something talking about teenager breakup with their boyfriend or girlfriend?
yeah, I firstly I would say we don't know how old uh, this child is, boy or girl, and how old that child is. But what I would say is, as long as you're a teenager, whether you are um, 13 years old or all the way up to 18, it's important to have friends that are your age, friends that are girls, friends that are boys. But uh, it's still not the wisest thing to um, be involved in relationships that get too close, because uh, relationships that get too close comes with all kinds of other stresses and for lack of a better term, garbage and things that uh, children at that age, teenagers, are sorely inadequate to deal with. Even as adults, just tell them, even as adults, relationships are difficult. Marriages are difficult. Um, uh, even for mature adults. So at that age, better to encourage them to have friends, friends that are girls, friends that are boys, but uh, not close boyfriend girlfriend relationships at all possible. That can be left to um, after their teenage years.
Great. I think our time's really up. It's 12, 2 minutes to 12. But I see a lot of people writing in the chat that to say it's an excellent, very valuable seminar, and they want to just show their appreciation to Dr. Daniel Tan. And I really appreciate his time. And hopefully in the future, we can invite him back and to give us more, advice and wisdom in this area. Let's give him a big hand, and then, we'll close this webinar. And then for those that you say, oh, I come in late, I missed a lot, just wait a week and go to our website. We'll have this seminar recorded. You can always watch it there. Thank you. Appreciate your joining us. And then hopefully we'll see you again in October 3rd. If you have children that suffer or have a mental issue, that would be a good workshop for you, because we interviewed family, mothers and youth that they struggle with the issue, and they talk about their experiences.